You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic. He's actually a pioneer in this particular procedure. He's trained thousands of dentists all over the world, literally, on this procedure. With us, we have Dr. Robert Schroering. Dr. Schroering, welcome to the program.
Thank you, Randy. It's great to be here.
Now, that's true, right? I mean, you've actually traveled the world to teach other dentists?
I've taught in Australia, China, India, Middle East, all across America.
Okay,
Yes.
good. Now, for people that don't know your implant center there in Louisville, who's the typical dental implant patient?
Well, Randy, there's really two different type of implant patients. There's the patient that has a denture, and they're suffering with that, and then there's the patient that still has their teeth, but those teeth are infected, bleeding, they're malaligned, they have decay, a lot of them have abscesses, and so they've got a lot of infection, they have a lot of pain. Sometimes they don't have pain, but they know they have a problem, and those problems amount to, through the years, just on top of each other. And so those patients know they need to get something done. And they come to me and they say, you know, what can you do? Because they know their teeth are hopeless.
And they don't want dentures. I mean, is that the people that go to you don't want dentures?
They do not want dentures. None of those patients want dentures. The patients that have dentures don't want dentures. They have one, but they don't want it. You know, a denture's just, the way I like to describe it, it's like the difference between a bike and a car. Both will get you somewhere, but both of them get you there in a totally different way. Anyway, they don't want dentures at all. They're tired of taking their teeth out. They're embarrassed about that. They can't chew and eat the foods that they want to eat. Patients come to me all the time and say, I just want to eat a salad again. I want to be able to sit down and have a green salad before me and be able to eat this without having to worry about it. And they really just they can't chew and eat the foods.
How old can you be to get this done? Like, what's your oldest patient?
My oldest patient is 96 years old.
Why would a 96-year-old want to do this?
That's a great question, Randy. A lot of patients come in and say, you know, I think I'm too old for this. Well, the older you get, the less you can do. You can't do sports, you can't do a lot of different things.
Okay.
But every day, typically, you're going to eat 3 meals a day. And the older you get, the more food becomes important to you. Not just for your health, but just for enjoyment of life, just quality of life. And when patients go out to eat and they can't order the things they want, if they can't enjoy the small things in life as they get older, life's not much fun. So why wouldn't they want to get implants?
So 96 years old, they're not statistically more likely to fall out?
Fall out, the implants? Not at all. My 96-year-old I had, she healed like a teenager.
So when you hear like a 75-year-old going, Doc, I think I'm too old for new teeth.
Yeah.
Is that kind of funny to you a little bit?
It is kind of funny to me. I've heard that quite often for some older patients, and they'll say, oh, I think I'm just too old for this. Like, why are you too old? You came in here because you have a problem. You're going to heal just like anyone else, and this is a solution to your problem.
At the top of the show, we said no more dentures. Do you think that's the future of dentistry? Like maybe, 40 years from now, dentures as we know them today won't exist? They'll all be attached to something? Do you think that'll ever happen?
I like to think about dentures as like a wooden leg. You don't see people walking around with wooden legs anymore. They have different prostheses. Now, those prostheses nowadays are attached. So they can do some amazing things, and we can do the same things in dentistry.
At your center, correct me if I'm wrong here, the way implants are typically done is you go to one place that does the surgery, and another place where they put the teeth on top and then even maintain them elsewhere. You do it all right there in your is that why you do it so quickly?
For a lot of my patients, I do everything right there in my office. Even the lab work is done in my office. Usually there's 3 components. You have the surgeon, you have the guy that puts teeth in, and you have the lab. Well, I combine those all together in one site. Now, I do have patients coming from dentists that it's an honor for me that they send them to me, and I take care of those patients.
A lot of the local dentists refer you the surgical
A lot of
part
referring
of this.
dentists, yes. I've had over 100 referring dentists in the past, and so I have a lot of dentists that refer
So
to
people
me.
like their dentist. They could go to you and you guys team up together to get this done.
Absolutely, absolutely.
And you say you can do this in as little as like 3 visits. If everything works out.
Everything works out. Consultation, we can take care of the consult. That's 1 visit. Surgery and connecting the teeth, temporary teeth at first. 2nd visit.
But it's still upper and lower teeth that don't come out.
Yes, always upper and lower teeth that don't come out.
Is that right? So in little as 2 visits.
Yeah. Now, I shouldn't say always, because sometimes the patient doesn't need both arches. Sometimes it's just 1 arch, and sometimes it's you just save the other teeth.
So in Kentucky, are there a lot of people wearing a denture or headed to dentures?
Randy, actually this morning before I came in here, I looked up the research on that, and for 65 years old and under, Kentucky leads the country. We're number one when it comes to tooth loss.
Is that right?
We have a huge amount of our population that has dentures. You could take our football stadiums, either whether it's University of Louisville, University of Kentucky, you could fill that 11 times for people just to wear dentures. Dentures. We're not talking about just people that wear partials, missing teeth, other things. That's 700,000 people.
Well, it's so good, why aren't they all doing it? Like if getting new teeth supported by implants is so good, what's your take on why they're not doing it?
That's a great question.
Like especially the denture wearers.
That's a great question. And I can tell you, every patient that comes in wants this.
Okay.
They all want to have this done. But a want and a need are two different things for patients.
Okay.
Now, the patients that decide to do it know that, hey, I need to be healthy. I need to be happier. My life's not really meaningful. If I can't eat the good foods that I need to eat, I'm not going to be healthy. If I can't feel good about myself, I have to put my hand over my mouth. If I can't communicate in a way where I can smile and laugh without feeling self-conscious, my life is not good. So our patients that come in and know they need this are the ones that say, hey, this is enough. I don't need to live this way. I don't need to be hiding something. I don't need to be holding myself back in life. I don't need to not be smiling because I'm embarrassed. I don't need any of that. I'm giving that up. I need this.
We talked about this in the green room, but a lot of the new guys, new dentists, start out with the snap in, snap out teeth.
Yeah.
You're not a big fan of that.
I'm not a big fan of that
Why?
because you still have to take the teeth out. There's still a lot of maintenance. When you have the type that are permanent, you have to get them clean, but you don't have to replace the attachments inside. You don't have to replace the teeth over time. There's a lot more money involved.
It's
in
still
that.
a denture, right? I mean, if you're snapping in and
Still a
snapping out.
denture. They're going to wear down. So there's a lot of things with that requires replacement and repair when you don't have that with a permanent set of teeth. And sometimes patients lose those teeth. I mean, they have to
Oh, is
clean
that
them.
right?
Oh yeah, the dogs love those. That's the best chew toy in the world. And they'll come in and they'll say, you know, I left it in a napkin when I was eating, and I just forgot about it. And so
Now, your office, they're actually printing the teeth in the
Yes.
other room?
Yes, yes. We
Like
actually have a
digital
milling.
printer kind of a thing? A mill or what is it?
We have a digital 3D printer, and we have a milling machine. So we have zirconium milling. That's some of the highest technology. We use the best quality products. This came out of Italy. The machine that we use, it's amazing. It's the best in the market.
What do they like more, the way it looks or what they could eat?
That's a great question. I ask patients sometimes that, and they say, well, I really love how they look. But then they'll say, but I love what I can eat. And then sometimes they'll call us up and say, hey, can I eat this and can I eat this? I said, you can eat anything you want. These teeth are yours. They're permanent.
I mean, can they bite like a raw carrot with their front teeth, or you got to be careful with things
Without
like
any
that?
question.
So
Yes.
almonds, doesn't matter.
Doesn't matter. We actually used to take patients at the day of surgery, and we had them bite an apple when they woke up with their teeth, just for that effect.
Interesting. So you did implants back in 1991. You were doing this.
First time I put implants in was 1990.
Is that right?
Yeah, that's when I started my training.
So is it now? Does it, because look, you're one of the most experienced guys in the country. I'm not siding with you. I mean, that's just a fact.
Yeah.
Does it cost more to go to a guy like you?
Not at all. Not at all. Actually, I would say it probably costs less to come to me. It does cost less to come to me because we keep everything in one center.
Okay.
We can do the lab work at that same time. So we do a high volume. When we do a volume like that, we can keep our costs down. You know, when I used to train people, it always amazed me because I'd have people come from dentists from Alaska, Hawaii, California, different places. We'd have 30 or 40 dentists in each time we do our training. And those dentists, when I'd ask them this question, what do you charge for your implants? Every single one of them. Never did I have anybody that charged less than I charged. It was
that
amazing
right?
to me.
It's just because what you're just more streamlined, like you just said.
More streamlined, and you know, I'm happy. For what I make, I'm very happy. I don't need to go
I mean,
out.
you are. Look, I know what other people are charging. We've done some research. I mean, you're substantially thousands less than most guys. Most people are financing this, I guess, because insurance doesn't really cover this.
lot of people come in and say, well, I would get this if I had insurance. Well, insurance covers maybe $1,000, $1,500. It doesn't cover much. Dental insurance is never designed to cover much, and most of the time they won't cover these type procedures anyway. They will cover extractions. They'll cover the things that create a handicap for you and get it so they don't have to pay anymore.
But people are financing this.
People are financing, yes.
Okay.
It's very common. And we have a great financial company. We keep the payments down low. It's very successful.
Now, for the denture wearers, that are watching this, isn't it true, though, that if you've been wearing a denture like 10 years, you can't do this, you don't have enough bone to do it?
I'm glad you brought that up, Randy, because I'll have patients come in all the time, and they'll tell me, well, I went to my dentist, and he said, I just don't have the bone for implants. And I'll look at them, and I think, I can do any technique for any patient. We can take care of that patient with implants.
Then why is it being said?
Because of their experience.
So it's based on experience?
Very much so. Those dentists really, they'll tell the patient what they can do.
Okay.
But they don't realize, or maybe they just don't really want the patient to go somewhere else to go and see what another dentist can do, because any patient comes in, whether we do zygomas, different types of implants, we can always take care of that patient.
So you've never had to turn anybody away because they don't have enough bone?
Never had to turn someone away.
In fact, have you ever been referred these complex patients that have limited bone?
I get referred all the time, these complex cases.
So this is kind of what you do?
Yes.
It's right up your alley?
Yes.
So the patients, they can eat? How soon can they eat after the procedure?
They can eat that day.
Just have to take it easy at first?
Not so much.
Really?
Yeah.
Is this one of those things where they say, Doc, I should have done this years ago?
I've never
is that one
had
of the
a
regrets?
patient. I've done 12,000 implants. I've never had a patient say, I wish I didn't do this. Never. That's amazing for any kind of procedure.
I know we joked about, we were talking about the most expensive part about this implant thing is going out to eat all the time. Going on cruises, things like that. They want to eat more.
Patients love to go out and eat. Once they have this done, they enjoy themselves. There's another thing about it as you get older. As you get older, the most thing you do when you go on a trip, you come back and you talk about the food.
Yeah.
And these patients have been missing out for all this time. Now they get full implants, fully supported teeth, and they come back and they're talking about the food. They're talking about how enjoyable it is, what they love about it. And for me, that's one of that just is satisfying.
So it's more than just teeth.
It's always more than just teeth.
I know they were fighting words in our green room, but I said, isn't it just teeth? But you've seen the changes. You say people change.
I see a huge
It's more
change.
Their charisma changes.
I see everything change. Psychologically, when you think about it, if you don't love something about yourself, if you're hiding something about yourself, you're not going to love other people the way you should. And I don't mean
it holds
that
you
in a bad
back
way.
kind of a way?
It holds you back. It holds you back. And because you can't express that, because you're always hiding and you're always thinking, well, they're not going to like me too much. If I smile, they're not going to like that. So they're holding back. And when they regain their smile, everything changes for them. They're more confident. Their relationships are better. Life's all about relationships. If you don't have good relationships, you're not going to be happy. If you don't have a good relationship with your spouse, with your children, all those kind of things. And when you don't feel good about yourself, it's hard at times to have a good relationship.
Are you ever on a consult and the patient has really bad teeth and gums? It's been determined that you need to remove their teeth. But do you ever get excited thinking they have no idea how good this is going to be? Does that ever happen to you?
All the time.
Like in your mind, you're going, boy, they think it's just eating and chewing.
Yeah. Randy, you said exactly. It's a slow process. And when they don't really realize over the years how this has brought them down to this level, and then overnight that's changed, it's dramatic. It's dramatic for them.
Is that right?
It's amazing to see the expression on their face, to see the joy they have, and also see their family members come in and say, wow.
They're happy too.
Oh, they're ecstatic for them.
Yeah, but what if you have bad gums? I mean, if you have gum disease, aren't your gums too bad to hold these things in?
Randy, I'm glad you asked that, because sometimes patients think, well, I've got to clear up this gum disease. I've got to take care of this before I can get dental implants. There was a case I did yesterday. Patient had terrible gum disease. So bad.
That's an infection, right? We're talking about a bacterial infection in the mouth?
Bacterial infection, bone had been lost, the teeth had moved, they were floating. Before we even started, my assistant put an instrument in the mouth, one of the teeth fell out. I didn't touch her.
Wow.
But the teeth fell out. They were that loose. And so we removed those teeth, those infected teeth, cleaned everything up, put in healthy implants and healthy bone, and today she has beautiful teeth. She has no infection.
So the bad breath goes away, those kind of things?
Everything goes away, especially the bad breath.
For the patient that it's been determined they're going to get the upper and lower set of teeth supported by implants that don't come out, what can they expect on the consults and the day of surgery?
Well, beforehand, we need to make sure we have the CBCT, three-dimensional images. We want to design those teeth. We want to make sure they're fitting that patient perfectly.
Okay.
So the day of surgery, when we go in, the patient's going to be put to sleep, going to be very comfortable.
Through what? IV sedation?
IV sedation.
Okay.
And then we're going to perform the surgery, place the implants, and then we're going to place the teeth that same day. So they're going to leave with those beautiful teeth that we just designed, that they've approved, to make sure that they walk out with a beautiful set of teeth.
Okay, and these are like a temporary set of teeth that they wear for about 4 months?
These are. They're a temporary set for 4 months. We want the bone to really form into the implants. We want the soft tissue to recontour and to be healthy. We want to make sure everything's right. Sometimes we can hit it right on the number and we've got the teeth already perfect. Sometimes we have to adjust a few things. But that second set that we make, those are the permanent final set, and those are beautiful.
What are they made out of?
They're made out of zirconia. Zirconia is a hard metal. It's a metal, but it's really like a porcelain. So you can get translucency like you have in your teeth. I have a lab person here, that's all she does. She's amazing. She's been doing this for 30 years. And we get those teeth designed, stained, just the way you want them to look gorgeous, so that those teeth you'll never have to worry about again.
So in a perfect world, you're going to meet the patient, maybe on the first consult, get to know them a little bit, find out their history. Maybe the second appointment, you do all your measurements, x-rays, things like that. Third appointment, they're getting their new upper and lower teeth that don't come out.
Yes.
Now, I simplified that, but does it work like that? Is that rare, or that's how it's done?
No, that's the norm. That's usually what we do. And sometimes we skip that measurement appointment and we go straight into the surgery.
So you can do it in as little as 2 appointments?
As many times we can, yes.
Is that right?
Yes.
And you IV, they're numbed up, obviously. IV sedation. How safe is IV sedation?
IV sedation is much safer than if you went and did general anesthesia at the hospital. It's what you get when you do a colonoscopy. A lot of people get colonoscopies after they get 50 that's required or it's recommended. And so the patients are comfortable. They're not...
With IV sedation, though, you're monitoring their vitals.
Yes, of course.
Right? Okay.
And we're just making sure they're relaxed, the blood pressure's down, the heart rate's under control. Really, for those patients, it's safer to do it with IV sedation than having that patient awake and just numb. Because when they're awake, heart rate's going, they're moving, the procedure it doesn't go well. It goes much better when we can sedate that patient, have them comfortable, and then when they wake up, they're finished. They're complete.
So when they get a ride home, they have very little memory, you say, of the procedure.
Very little memory.
And you say they could eat softer foods that night.
They can eat softer foods, and really they can quickly go into some harder foods. Now, we don't want them biting a carrot the first day. Okay. But it doesn't take long. Those implants, when I place those implants, are very tight. So we're not worried about the stability of the implant.
And at your office, you actually have mills and printers where you're making some of these teeth, or you're making the teeth right there. Is that right?
Exactly. We make them right there. We have a lab in office to make sure that we can control the quality. Because other dentists send something off to a lab, they never see that patient, they just get a script. I wanted to make sure that we had somebody in-house that could get to know that patient, look at that patient, see exactly where the teeth need to go, try those in, make sure we get a perfect fit.
Okay, and you say that as far as the next day, the day after, that they're not really complaining about pain too much?
No, it's amazing to me.
Even over-the-counter remedies they can use for pain?
Most of our patients use ibuprofen and Tylenol. Extra strength Tylenol. That combination usually takes care of everything.
Are they a little surprised sometimes? Like they say, boy, I was so worried about this.
They're very surprised. And most of them tell us that, I had other procedures done and it was something I had to worry about. And with this, it really was simple.
Sedation dentistry. You're big on sedation for these implant procedures.
I am. Most of these patients come in, they're fearful. I'm just like it because my patients love it.
Okay.
I mean, I can take a patient and relax them, do the procedure. They don't really remember what's going on. For smaller procedures, we can give them a pill the night before. We can give them nitrous.
Like the gas?
Like the gas, yes.
Okay.
It's the happy gas.
And they're just relaxed and everybody's numbed up?
Exactly. And so those patients, they go through the procedure, They're not nervous. They're not anxious. It takes all the nerves away. For sedation, they really don't know what's going on. They don't care what's going on. They don't remember anything. They need somebody to drive them there, somebody to drive them home.
Okay, I'm going to get your opinion on this. I've had dentists that have been on the program that say, I just numb them up. With good bedside manner, that's all they need. Do you think that's insensitive?
I think they
Or
need
maybe they don't
to,
get it? Don't hold back here. What do you think?
I think they need to get some extra training for sedation because some of these procedures are fairly long, and those patients need to be comfortable. And
Okay.
yes.
So you like it, sedation on every patient?
It's not that I like it. I do like it, but my patient likes it, and most of them warrant it. They need it.
We've talked, you say people with bad teeth are judged,
They are
and
just.
sometimes unfairly. Could you
Well-
elaborate on that?
Well, think about it in Hollywood. When they have the bad guy, what does he have? He doesn't have perfect teeth. He usually has bad teeth. When you look at a horror movie or something, they try to make somebody look scary, they give them terrible teeth.
Or like a homeless person in a movie.
Homeless person, yes.
So why, if you're only missing one tooth, why a dental implant over a traditional proven bridge?
Well, the only way to naturally replace a tooth is to place an implant and place a crown on top.
Okay.
Because one, if you don't, the bone's going to shrink. Number two, if you put a bridge down, you're cutting those teeth down. You're damaging those teeth by taking the enamel away, taking some of the dentin away, and then cementing on something that has a life expectancy of maybe 10 years. Now, I've done implants for 32 years. I've seen some of my patients that have had those implants 25, 30 years later, and those implants look just as good as the day I put them in. Implants are the only effective way to replace a tooth.
Is it less expensive in the long run to
Without-
get an implant over a bridge?
Without question, it's more expensive because a lot of times these patients are attached to this bridge and then they get decay under it. They don't know they have decay. And then it's too
that
late
right?
and they lose that tooth, and now they've lost another tooth, and now they've lost the bone where that tooth was missing. They have to get grafting. All these things factor into that, so they're going to have a lot more cost.
So would every expert agree that an implant's always better than a bridge?
Without question.
Why don't they all do it then? Is it just because people are afraid of like the patients going, well, I don't like the surgery part of it?
Some patients it's because of fear. Sometimes it's just a dentist. That's what they were trained to do. They
Doesn't
like
do
to
it.
do it that way. Yeah. They don't do implants and they say, okay, let's just do it.
If you were missing teeth, would you always get an implant over a bridge?
I have 2 implants.
Is that right?
I do. I have implants, and I had root canals done on some back teeth that I'd fractured, and those teeth failed. Root canals will typically fail over time. And I had those removed, and I have 2 implants. They've been in for 15 and 13 years now and doing great.
You offer a 10-year warranty on all of your implants cases,
I do, Randy.
which you say is rare.
Well, it is rare. And I talk to my colleagues, and they don't offer any warranty. And I say, why not offer a warranty? Patient implants, they last forever.
Okay.
If you do things properly, everything's going to work. But they don't, and I'm not sure why, but I like to have my patient have that peace of mind, just to know that anything goes wrong at any time, we can take care of that. Rarely does it ever happen, so I don't worry about it, but I don't want the patient to worry about it. So we give them that piece of paper just so they know we're going to take care of them.
So dental implant costs. I'm sure this comes up all the time. How much is it? So what affects cost when it comes to dental implants?
Well, Randy, there's a lot of varieties in the cost that affect the cost. One is the type of implant you use. You could use mini implants, which I never recommend because they have a high failure rate. You could use some implants that are just cheap implants.
Okay.
They're made over in Asia and they're not designed well. They sell them a third of the cost.
Okay.
But never would I use an implant like that because I want to use the top quality.
Okay.
Now, because we use the top quality, or because we use the volume that we have, we can keep that cost down. The second biggest cost is really the lab. Now, normally the way it's done is they send it out here, they send it out there, they get what's back and they hope it works. And they got a huge cost to that. We don't do it that way. We have an in-house lab with an amazing lab technician who does great work, precision work, beautiful work, and we keep the cost down.
So you print the teeth, like digitally print those teeth in the other room?
Yes.
Okay.
Yes. And actually our patients come in, we can show them our lab and we show them the 3D printer, we show them our milling machine. Yes, everything's done in-house.
And you say some people need more surgery than others.
Some people do. Sometimes you have to add a couple implants. Sometimes you have to do some bone grafting. Different patients require different techniques. So every patient is customized. We don't do cookie cutter for anybody. And we make sure that we get the results because the best thing we can do for a patient is give them something that's going to last a lifetime. And to do that, we have to make sure that we're on our game and we do everything just exactly for what that patient needs.
Now, I had an oral surgeon tell me this. He said, Randy, it's very frustrating. I'm paraphrasing slightly. He goes, it's very frustrating because online, on Google, there's dentists, the majority are posting the price of implants as just what the implant cost.
Right.
And it's misleading.
Very misleading.
What are your thoughts on that?
See
So you don't like that either?
No, of course not. You'll see somebody say, well, it's implants $999. And what is that for? That's for this part that goes down in the bone. That's just a third of the portion of what you're doing.
Okay.
So when you actually go in, it's much higher cost. The only way to truly know is to get the 3D image, come in.
Get them in. Okay.
Get them in, and make sure always that you're getting the best quality. You cannot compromise on quality.
We are out of time. Final message.
Yeah.
The two groups of people currently wearing a denture, or their teeth are so bad they have to all be removed and they don't want a denture. So if they go to your practice, or just in general, what are the options when it comes to dental implants?
Well, the first option is 2 implants on the lower. 2 implants are an option that still require or have some rocking to the denture. So I don't really like that too much.
Like a snap in, snap out.
Snap in, snap out.
You don't like that?
I don't like it because they still have movement. They still complain. They still get food underneath there, seeds underneath there.
Okay.
You can go to 3 or 4, and that's much more stable. That's much better.
For snap in?
For snap in.
Okay.
Now, the upper, I don't like snap in at all.
And that's being done? Just so I'm clear?
That's being done, but I've been around for 32 years doing these procedures, and I see after 6, 8, 10 years, I see problems with those.
Okay.
I don't want to do anything that's ever going to be a problem for a patient. I want something that I do for the patients, something that's going to last for years, hopefully till they don't last.
Okay.
So I want it to be permanent. When I say permanent, I mean permanent long time. We also give a 10-year warranty for our patients.
That's
so
nice.
We make sure that they're comfortable and happy and that they're insured.
So like a full arch of teeth on 4 or 6 implants, both upper and lower?
Yes.
Okay. Yeah, but for the denture on the upper, that's okay because there's suction, right? On the upper denture?
Randy, you've never worn a denture, have you?
No.
And I can tell.
Okay.
Because the denture covers up the palate. That's where the taste buds are.
Okay.
And patients hate that. Patients hate the fact they can't taste their food anymore. And there's just a lot of maintenance to those.
So upper and lower teeth that don't come out.
Upper lower teeth that don't come out.
So no more dentures, like
No
we
more
said at the
dentures.
beginning of the show.
No more
so
dentures.
final message. Let's say the 2 groups of people watching this, the denture wearer or the people that are headed to dentures, they saw what they've heard this. They've listened to you today, but they're still skeptical or maybe even afraid. What do you say to them?
I say that they need to come in for a consultation. We can sit down, we can go through all the procedures, they can see the different models we have, we can educate them. The only reason they'd be skeptical is they just aren't fully educated, but we can solve that problem.
Okay, good. Do you meet all the people on the consults?
I do.
In your practice?
Yes, I do.
Okay, I want to thank you for coming on the show. Good stuff.
It's been great.
If they want to make an appointment, do they do it through the website or they just call your office?
They can do either or.
Okay, good. Thanks again.
Yeah. Thank you, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.